All right, we're here live after 5 on Saturdays, and what we're pretending to do is to think that everybody in the world knows that we're here and will come out and participate with us. And even if they aren't, we're certainly going to broadcast to the world. We're taping this live out here at 1113 in Irvington, New Jersey. And what we're really doing is raising awareness in our community and asking everyone to come out and participate. We want to show that there are some positive things going on here in Irvington. We're here at the Veterans Servicemen's Clubhouse here in Irvington, New Jersey. And what I'd like to do is have an opportunity to share with you someone who has been doing exceptional work in the healthcare profession. This woman has been on the forefront of really raising awareness in relationship to what's important about health in our community. She works at UMD&J in Newark, New Jersey, but the responsibilities that she has is involved with developing ways in which the people who work in her area of support and management get adequate representation. And we're here now with Ms. Elmer Daniels. And Ms. Daniels, thank you so very much for coming on over and sharing with us some of the most important things about healthcare in our community. Why don't you give us an opportunity to find out about you and who you are and what got you involved into the work that you do?
Well, thank you, Herb. My name is Elmer Daniels, and actually, somewhere I think I knew long ago as a child that I wanted to be a nurse. Mm-hmm. I don't know if it was the white starched hats, the white dresses. I just knew that I wanted to help people. So along the way, and I took many different paths, I went to school and I became a nurse. At that given point in the turn of my life, I went and attended UMD&J because at that time they had the School of Health Related Profession. They were connected with Essex County Community College. And I felt what the right place to be to learn about helping patients in my community.
Okay.
And so through that process, I went to school, graduated, took boards, and then started working in the community. Mm-hmm. Started working with the hospital, working with the patients. And what I found was that it's a different group of people. For whatever reason, they always ask, why do you work there? You could work anywhere. I said, but you don't understand. When we help our community and we help our patients, they are so thankful. Mm-hmm. It's a feeling of satisfaction that I could not get up at the hill at Barnabas.
Okay.
Okay. Or anywhere else. So when I go into work every day, I have patients that actually say, thank you so much, Ms. Daniels. You made my day. Mm-hmm. Thank you for helping me do this. Thank you for helping me get to this point. So that's how I started. Mm-hmm. And with that, with the different changes at UMD&J, then I started joining the union process.
Okay.
The Health Professional Allied Employees. And I said, we have to set standards because if we don't have the right amount of nurses to take care of the patients that come into our hospital, they're not going to get what they need or what they deserve.
Okay.
So having did that, we developed ratios to say, if we have a certain amount of patients on this unit, we should have XYZ amount of nurses to take care of their needs.
I see. So it really started out as an observation.
As an observation. And then we went on to develop legislation to say, you know what? No more mandatory overtime. Because at one given point, you would come into work and you couldn't leave if there was no one there to relieve you.
I see.
And so with that and legislation, we got that law passed that, okay, you now need to still have enough people to take care of the patients.
Okay.
We developed like mobile homes because we realized that there were patients out in the community that couldn't get to the hospital for care. So we relied on going out into the community to provide the care for our patients.
The outreach effort in itself had to develop some kind of compensation, or in terms of the funding for that. It didn't exist. How hard was it to make the hospital appreciate what you were doing in your outreach effort?
What happened was that they did realize there was a financial responsibility. And in that, they also realized that we need to develop more preventative care. Because if we don't go out and help now, then we would find people in our emergency room
Right.
with so severe diseases that it could have been prevented if we had just gotten out into the community.
Wow. So the idea of creating it made it an advantageous effect so that they can appreciate the fact that now it was helping people who were in that kind of situation overcome those obstacles.
Exactly.
Now, looking forward at the relationship of how things are changing, the restructuring of the hospital in relationship to the school, and the relationship of how now there's going to be a new way the administration is being identified to, what kind of relationship has really developed in that process?
Well, different relationships with different people. Because at this point now, we're informed that Rutgers will actually take over all of our schools of medicine, the dental school, the School of Nursing, our Cancer Institute, our University Behavioral Health Centers, and University Hospital will now have to stand on its own.
Mm-hmm.
We will still have affiliations. Physicians and people who are training still come through our institution. However, we will have to be able to learn how to survive on our own. And with that, Governor Christie has indicated he would support us since we are what they call a safety net hospital, meaning that we have a high volume of charity care patients that do not have insurance, meaning that we are a level 1 trauma center. So when you start hearing about the motor vehicle accidents and the gunshots and so forth, they are coming to our institution for that particular care. So having said that, we were able to get the group of legislations with Speaker Oliver and all the assembly people together and actually help us move towards developing a legislation that said 2014 we will keep everything intact as far as the university hospital, keep all of the services available to the people in the community. They will now bring in, they're paying to bring in a consultant firm.
Really?
Yes, to manage the managers that are there now.
Now, that's something that seems to be intimidating. Wouldn't you agree?
Intimidating is a kind way to put it. Our concern is that as employees, we have come up with resolutions of how we could do things better, how to take care of patients better, what may be needed, and it kind of fell on deaf ears, but now we're seeing that they're willing to actually pay like $1.5 million for other people to come in to explain to them how things should be done. And then what happens? Do we reduce our services? Currently, we are a 519-bed facility.
Okay. Are we utilizing all 519 beds?
I can tell you now, unfortunately, that we have literally closed approximately 3 to 4 of our units.
Really?
Yes.
Based upon this new direction.
Based upon the new direction.
So how does that impact care?
Well, now we have people coming into our emergency room division, and either we're going to triage them there and send them back home.
Wow.
Either we're going to triage them in hopes that we can reach out to community health care services and get them some home care services if that's what they need.
So the dynamics of being able to treat someone immediately has now transferred into an outsourced kind of an effect.
And an outpatient
Okay.
effect.
Okay, and I'm thinking of it from a business perspective, but
Yeah.
from a hospital perspective, outpatient care now has been the relationship that you have built some type of relationship with, and we still don't have statistics to find out if this really is going to work.
No, we do not. As a matter of fact, we have asked the governor and any other legislator, how much is this going to cost? How much are you willing to fund us so that we can keep the community viable, keep the hospital viable, keep the care going that we have? And to this date, we have not received an answer.
So what do we do to help?
What we need to do, and we've had town hall meetings, we've had meetings with different budget committees. What we need to do is to get everyone in the community aware that we do not need to lose another hospital in our community, because loss of hospitals mean loss of care to everyone that may require help.
Okay.
So in that sense, we need to be more aware that if they're making changes in the law and how you're going to be provided the care, we need to be there to say no. That this is the type of care we deserve in our community.
You are representing HPAA in relationship to the registered nurses that are there. Has there been any attempt to decrease the nurses that are on duty currently?
Unfortunately, yes. They have gotten into a management mode in which we are now beginning to lose our more senior nurses that know how to care for patients in specialty areas as well. And they're bringing in new nurses, part-time nurses, less benefits, less experience.
Cutting costs.
And costs,
Mhm.
and expecting them to care for our patients the way a more senior nurse would know or expect.
So in this situation, the real issue is that in our effort to raise awareness about what's really going on in healthcare, we need to actively get involved and participate, especially in some of the forums that are being developed. Now, there are some hearings that are being prepared, and a number of churches are getting involved with it. In the relationship of community-based organizations, block associations, how do we attempt to provide the kind of outreach information that your organization is sharing now?
Currently, what our organization has done is that we've paired up with Citizen Action, Appleseed, different Assemblywoman, Crump,
Okay.
and other individuals to say, wait a minute, there's something happening here in New Jersey that we fell asleep. We didn't see it coming, meaning privatization. We have companies from California and everywhere else coming in to buy up hospitals, take what they can from them, and then close them down. So, in these meetings, New Hope Baptist Church, thank you, Reverend, for giving us the facility to use. We have brought up many different issues of how can we stop this privatization? How can we stop these people from coming in to our communities, using up whatever we have left in our hospitals, and then selling off our properties because of prime real estate?
Okay.
And so with that, we've developed petitions. We've taken these petitions to Trenton.
Mm-hmm.
We've taken these petitions to the Department of Health, which, by the way, has been reduced in staff.
Wow.
So we're doing a number of things to try to get the powers that be to understand, no, this is a viable entity. We just had a meeting trying to support St. Michael's Hospital,
Okay.
which is right down the street from UMD&J.
Right.
That is actually being brought out by a company called Prime Care, whose history is well known. Privatization, once again, what will happen to the people in every quadrant of Newark, Irvington, and the surrounding areas?
Well, we certainly like to help create a forum here, because I know that you said Assemblywoman, but it's Councilwoman Crump.
I'm sorry.
And
Yes,
we have
she
council
is.
members here in Irvington who certainly we have been able to talk to them and invite them to get involved with this effort so that we can designate a real strong interest here in Irvington. And that has really been something that we're preparing for, and that's the reason why we're so happy that you came by to share with us this information. We're going to be looking forward to having more opportunities to work with you and get more information from you. We'd like to thank you very much for coming by.
And thank you for having us.
All right. Thank you. We're here live after 5. We'll be right back. All right. Thank you.